Renal cell carcinoma, commonly referred to as kidney cancer, is a malignant tumor that originates in the kidney. Your kidneys are two bean-shaped organs located in the back of the abdominal cavity, one on each side of the spine. Renal cell carcinoma begins in the lining of the tiny tubes within the kidneys, known as the renal tubules. These tubules play a crucial role in filtering blood and producing urine, making the kidneys vital organs for maintaining overall health. When the cells lining these renal tubules start to grow uncontrollably, forming a mass or tumor, they lose their ability to function properly and may also begin to invade surrounding tissues or spread to other parts of the body. Renal cell carcinoma is the most common type of kidney cancer, accounting for approximately 85% of all cases. It's estimated that each year, 400,000 new cases are diagnosed worldwide. It is more commonly diagnosed in men than in women, with a ratio of approximately 2 to 1, and it is typically diagnosed in individuals aged 50 to 70 years, but it can occur at any age. Types of renal cell carcinoma. Interestingly, renal cell carcinoma isn't just one uniform disease. It actually comes in several different types, each with its own characteristics and treatment considerations. Here are the main types of renal cell carcinoma. Number 1. Clear cell renal cell carcinoma. This is the most common type, accounting for about 70 to 75% of cases. It's called clear cell because the cancer cells look clear or pale when viewed under a microscope. Number 2. Papillary renal cell carcinoma, the second most common type, making up about 10 to 15% of cases. It forms little finger-like projections called papilla. Number 3. Chromophobe renal cell carcinoma. This type accounts for about 5% of cases and tends to grow more slowly than other types. Number 4. Collecting duct carcinoma. This is a rare and aggressive form of renal cell carcinoma, accounting for less than 1% of cases. It originates from the ducts that collect urine in the kidney. Number 5. Unclassified renal cell carcinoma. In some cases, the tumor does not fit into any of the above categories and is classified as unclassified renal cell carcinoma. Causes of renal cell carcinoma. The exact cause of renal cell carcinoma is not fully understood, but several risk factors have been identified that increase the likelihood of developing the disease. Smoking is a significant risk factor, increasing the chances of developing kidney cancer by about 50%. Obesity is another major risk factor, with studies showing that excess body fat can alter hormone levels and increase inflammation, potentially leading to cancer development. Other risk factors include high blood pressure, a family history of kidney cancer, and certain inherited genetic conditions like von Hippel-Lindau disease. This is a genetic disorder caused by a mutation in the VHL gene, which plays a role in controlling cell growth and blood vessel formation. Exposure to certain chemicals, such as trichloroethylene, which is a solvent used in industry, has also been linked to an increased risk. Interestingly, long-term use of certain pain medications, like finasteride, has been associated with kidney cancer risk. Age and gender also play a role, with renal cell carcinoma being more common in men and typically diagnosed in people over 50. However, it's important to note that anyone can develop kidney cancer, even without these risk factors. Symptoms of renal cell carcinoma. One of the challenges with this disease is that early-stage kidney cancer often doesn't cause any noticeable symptoms. As the tumor grows, however, various signs may start to appear. The most common symptom is blood in the urine, which may appear pink, red, or cola-colored. This isn't always visible to the naked eye and might only be detected through a urine test. Another common symptom is flank pain, which is pain or discomfort on one side of the body, typically in the back or side. The pain may be dull and persistent or sharp and severe. A palpable mass or lump in the abdomen or side may also be present in some cases. However, the mass may not be detected until the tumor is quite large. As the disease progresses, other symptoms may develop, including unexplained weight loss, fever, fatigue, and night sweats. Some people might also experience a loss of appetite or notice swelling in their ankles or legs. In more advanced cases, the cancer may spread to other parts of the body, such as the lungs, bones, or liver, leading to additional symptoms such as cough, bone pain, or jaundice. Diagnosis of renal cell carcinoma. If a doctor suspects kidney cancer, they'll likely start with a thorough physical exam, feeling for any lumps or swelling in the abdominal area. They'll also ask about your symptoms, medical history, and any risk factors you might have. Blood and urine tests are often the next step. These can check for signs of kidney problems and look for blood or other abnormalities in the urine. However, the most crucial diagnostic tools for kidney cancer are imaging tests. A CT scan is typically the go-to method for detecting and evaluating kidney tumors. It provides detailed cross-sectional images of the kidneys and can show the size and location of any tumors. Other imaging tests might include ultrasound, which uses sound waves to create images of the kidneys, or MRI, which can provide additional detail about soft tissues. In some cases, a doctor might recommend a biopsy, where a small sample of tissue is removed from the kidney and examined under a microscope. This can help confirm the diagnosis and determine the specific type of renal cell carcinoma. Once a diagnosis is confirmed, the cancer will be staged. Staging describes how far the cancer has spread and helps guide treatment decisions. The stages range from 1 to 4, with stage 1 being the least advanced and stage 4 indicating the cancer has spread to distant parts of the body. Treatment for renal cell carcinoma. Treatment for renal cell carcinoma depends on several factors, including the stage of the cancer, the patient's overall health, and their personal preferences. For early-stage kidney cancer, surgery is often the primary treatment. This might involve removing just the tumor and a small amount of surrounding tissue, which is called partial nephrectomy, or removing the entire affected kidney, called radical nephrectomy. Thanks to advances in surgical techniques, many of these procedures can now be done laparoscopically or with robotic assistance, resulting in smaller incisions and faster recovery times. For smaller tumors, especially in patients who might not be good candidates for surgery, other local treatments might be used. These include cryoablation, where the tumor is frozen, or radiofrequency ablation, where heat is used to destroy the cancer cells. In cases where the cancer has spread beyond the kidney, additional treatments are often necessary. Targeted therapy drugs, which attack specific abnormalities in cancer cells, have become a mainstay of treatment for advanced renal cell carcinoma. These drugs, such as sunitinib, pazopanib, and cabozantinib, work by interfering with the blood supply to the tumor or blocking signals that tell cancer cells to grow and divide. Immunotherapy is another exciting area of treatment for kidney cancer. These drugs help the body's own immune system recognize and attack cancer cells. Drugs like nivolumab and ipilimumab have shown promising results in treating advanced renal cell carcinoma, either alone or in combination with other treatments. Traditional chemotherapy, which uses drugs to kill cancer cells throughout the body, isn't typically as effective for renal cell carcinoma as it is for some other types of cancer. However, it might be used in certain situations, particularly for rarer types of kidney cancer. For some patients with advanced kidney cancer, a combination of these treatments might be used. For example, surgery to remove the primary tumor might be followed by targeted therapy or immunotherapy to address any remaining cancer cells or to prevent recurrence. The prognosis for renal cell carcinoma varies significantly depending on the stage and diagnosis, with early-stage cancers generally having a more favorable outlook. For localized kidney cancer, stages 1 and 2, the 5-year survival rate is quite high, often exceeding 90%. However, for advanced or metastatic renal cell carcinoma, stages 3 and 4, the prognosis is much less favorable, but many people are now living for several years after diagnosis. Now, we want to hear from you. Have you or someone you know been diagnosed with renal cell carcinoma? What has your experience been like, and how did you first discover the condition? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.